Hello everybody. In my awareness raising videos so far, today we will discuss about what is Alzheimer and dementia. Can we prevent that? And if it does, what is the solution? And what exactly is dementia and Alzheimer's? And can anybody and everybody suffer from this disease? So first of all, I would like to say that we all know what is dementia, Alzheimer. Lot of information is available online. But besides that, I would like to highlight very important things which I have learned across more than 20 years of my research in dementia. So, since 2008, I have been working on understanding dementia, developing test that's a screening test for dementia, that is UMACE, and also for the rehabilitation, that is brain next, which I have developed. So, first of all, I would like to say that dementia, what is dementia? That is neurodegeneration for the brain. It has reasons behind it. Everybody cannot have dementia. It is not age related. There is always a strong reason behind having this neurodegeneration. So, all the normal brains after the age of 45, there is natural neurodegeneration. That means decreasing the neurons in the brain is natural after the age of 45. But it is naturally done, which is extremely minimal. So the normal brain doesn't have or doesn't experience any lack of because of that action. So it's a natural action for the natural brain. And for developing dementia, it may be Alzheimer dementia, it may be a dementia after stroke that is called as vascular dementia. Parkinson, if the person has diagnosed with proper Parkinson disease, because diagnosis done for Parkinson is a very, very complex process. I will talk about Parkinson in a separate video. But suppose if a person is diagnosed with real Parkinson disease, then after that the person might develop dementia. After head injury, the person also might have this dementia. So what dementia exactly is? It's not just about the memory loss. Memory or dementia is a very small word to actually illustrate the condition of the brain, because memory is about everything. Cognition is about everything. And for the brain, it's a very, very, very complex work and task. So when dementia is actually diagnosed, there is always a reason behind that. And there is always a very, very strong reason for the deficit. The deficit doesn't occur instantly. Only the exclusive reason is about the traumatic brain injury, that is head injury, which can happen anytime in life. It's not necessary that head injury will happen in a particular age. And that's a sudden hit for the brain. And after that, the deficit is there for the brain for memory, cognitive, and motor as well. So, making the actions that we call as motor deficit. So, all these deficit or developing dementia has a reason. And sometimes we have seen that people had a stroke, very mild strokes when they were young, and it was not diagnosed. And later on, they slowly developed the cognitive issues, memory issues, And when it became very severe, they came to us. And when they had the MRI that time, the MRI said that these people had mild strokes quite a long before. So, still, I always feel that the science does not actually diagnose or does not understand that whenever the person has something, like sometimes people have high blood pressure, high sugar, and then only the treatment is given for high blood pressure and the high raised sugar. Or maybe sometimes people have hypoglycemia, giddiness, something like that. But brain is never considered in these populations. And later on, after some years, when these people complain about memory loss or maybe some difficulty in understanding and remembering things, and maybe the family members start noticing that the person has a changed behavior or the person is not operating the same way as before, and then they realize that there were mild strokes before. The MRI cannot tell us that when exactly it happened, but we know that it's a chronic event which has happened some years before, some months before, and so on. So I want to say here and very prominently that there is always a reason to develop dementia. It cannot happen to everybody, and everybody who is having 60 plus of age, it is not like that. It's not easy. It's not easy for any normal brain to develop this deficit just because of age. So one should always think, if this has happened anytime in their life, the reasons which I just spoke about. And as far as Alzheimer's is concerned, diagnosis of Alzheimer's is extremely critical. It should have some neurobiological elements to understand that it is exactly Alzheimer's. And whatever the research has been done so far, it is done after the persons were deceased, and after that, with biopsy of the deceased person, the researchers came to know that there was some neurobiological element which was involved, and then the Alzheimer's term came into existence. So, in general, diagnosis with Alzheimer's and then Alzheimer's with dementia is currently understood by having neuropsychological screening. So, that is also, I must say, that it's a random memory and cognitive check. Some biomarkers are given in screening for a particular behavior pattern in Alzheimer's. But whenever there is problem in the brain, in the area which is involved in emotions and so on, which is inside the brain, which is a center of the brain, sometimes it's on the front side of the brain. So people used to have behavior issues, and this behavior is not because of psychological disorder. It should not be mistaken ever with psychological disorder. It's due to neurological reasons. So, understanding dementia, as I said, that one should sit sometimes, one should give time to oneself to understand, has this kind of a thing has happened anytime in their life, what is happening with their high blood pressure and sugar raise sometimes, because mostly we have seen that this is ignored whenever the people had high blood pressure episodes, raised sugar episodes. Sometimes people had hypoglycemia due to over restriction for the sugar, and that time other diagnosis or other treatments or other considerations were not taken that time, and later on these populations have developed dementia. So I must say that we can definitely prevent dementia. The most important message I would like to give everybody listening to this video: certainly we can prevent dementia. Dementia is not age specific or age related. Otherwise, every other population which is 60 plus would have had dementia. So it's absolutely not about the age. It's about if the brain has ever had any such problem, very high blood pressures, high sugar, hypoglycemia, head injury, any kind of any tumors or post-operative conditions for the brain, traumatic head injury, substance abuse, or any time the person had suicidal attempt, because any kind of suicidal attempt will create deficit for the human brain. So we have to think about, and we can certainly prevent dementia. And if at all it happens, as I said, with the basis of neuroscience, we can definitely create the same capacity into the neurons again, and then we can certainly create a very positive rehabilitation for the brain. That's what we have been doing past more than 15 years very successfully for all kinds of brain deficit, and that includes dementia. So we have a very successful memory recall for our dementia patients. The reason might be different for every other brain, but with rehabilitation, we can certainly create memory recall. We can correct the behavior in these people. Also, we can create the capacity into the brain. So certainly, there is positive point for the brain rehabilitation here. I would like to mention that. So certainly we can prevent, and we can also do brain rehabilitation even if there is dementia like condition at any age and at any severity for the brain. Thank you very much.